think we'll start with PCPI. We have Vivian here who will be talking about their IEHP specific programs and also other solutions that they offer. Thank you.
Good afternoon, everyone. My name is Vivian Nicoleme, and I work for Progress Career Planning Institute, PCPI. I manage a program that is dedicated to internationally educated nurses in Canada. My program
I'm with a tech company.
is called International
Making the process for the medical certification easier.
and
I'm
it's a
working
14-week
okay.
cohort.
So I wanted to come here today to see if I could get sort of a focus group.
The system was launched last year, April, and
There are some people from the other room there with Dr. Felipe who was specifically doing for
licensure.
So they haven't joined. They're busy in the discussion, so they haven't joined here yet. So
This
yes, it's best to like contact users and kind of understand the pain points of their process as they had to apply for, because you have to do a certification, right?
That gives participants access
Can you get in touch?
Yeah,
that would be amazing. Anyone is possible. Do you have like yes, I can give you my email ID. Brilliant, yeah.
And we have recorded a
with
lot
PMO
of
as well,
success
just
in the program, especially with having our participants write the exam just once and pass. I want to mention that this program is a national program. And what I mean by that is we support internationally educated nurses wherever they are in Canada. So it's not just internationally educated nurses in Ontario. Rather, it's any international educated nurse in Canada. It's a program that has supported them. We also support them with jobs that they need to do before they get their license and after they have gotten their license. Just reach out to me, or if you go to PCPI at www.pcpi.ca, you would get more information about the program. Thank you so much.
Thank you so much, Vivian. It has always been a pleasure working with you. Thank you. So up next, we have from Evergreen College. Hi. Are you? That's okay. So we have Evergreen College, and with us we have Din and Mohammed, and let us hear from them.
Okay. Okay, so morning everyone. So thanks for being here today, and yeah. In Evergreen, we started this wonderful program for the clinic assistant. And if you've been here, like in the other room with Dr. Philip, we to talk about the clinic assistant as a kind of a good opportunity to fulfill the gaps if you have any kind of research practice issue, especially if you're applying for the CARMs. And what we offer here is the what we call the clinic assistant training for the seniors. And this is a training that is a focused training for like 1 week. It's 38 hours of training you how to deal with, seniors as a clinical assistant. So it's more focused into like, the communication with seniors, safety and health like with seniors, all the way to communicable diseases and the different system kind of like, diseases, especially in the geriatric side. The training is for 1 week. That's 38 hours. And then you have a chance to have an optional placement in Kensington, kind of like long-term care. That's for almost 80 hours, which is almost like 2 weeks. And then you get a certificate as a clinic assistant of training, like a clinic assistant of a senior. And this is going to help you to work as a clinic assistant in long-term care, retirement homes, and family physician clinics under the supervision of a family kind of clinic, family medicine specialist. The other thing is that the whole course is almost like in total, almost like at like 40 days, like almost like 80 hours of training. But as I mentioned, that the 38 hours is virtual. But the 80 hours, if you want to get the placement, is optional, and it's in Kensington, kind of like long-term care. Yeah.
Wow.
Yeah.
That is brilliant.
Yeah, thank you.
Thank you so much.
Yeah.
Thank you very much for that.
Hello, thank you for the presentation.
Hi. You're welcome, thank you.
And I would like to know if Evergreen College is where is this college? Is it in Ontario or New Brunswick?
It's mainly in Toronto, and we have
Toronto.
different branches. Like and we have one in Oakville, and we have a couple of more, and then we have one opening soon in Alberta. The training virtually is going to be like, you can be anywhere, but if you would like to go with the placement, which is mainly in Toronto and Kensington long-term care, that's in Toronto. And that's up north.
Okay. I will live in New Brunswick.
Okay.
Okay.
Yeah.
In Moncton. And I am a medical doctor. Okay.
Nice
and
to
I'm
meet you.
from 80. And do you think that it's possible for me to follow this training?
Yes, because the 38 hours, which is the mandatory hours, 38 hours, this is the 1 week. That's online, so it's virtual, so you don't have to be physically in Toronto. But I mean, if you're willing afterwards to have the placement, which is the 80 hours, you can prepare, just arrange that you can come to Toronto if you want. That's optional. Again, it's for 2 weeks, and it's up to you to take it or not. But the mandatory part is the 38 hours.
Okay.
Which is online.
Okay.
Yeah.
Okay. Thank you.
You're welcome.
Thanks
Thanks. Yeah, thanks.
Thank you.
Thank you. Yeah.
Oh,
good. Thanks.
Thank you so much.
Yeah. Thank you.
Okay, thank you. Next we go to JVS Toronto. Hi. Hi again. So here's your mic.
Good afternoon, everyone. This morning we're
Both actually, one's for here and the other one's for.
so hello to everyone here and also the people who are online. So my name is Mohsen Jafar Gargani from JVS Toronto. So JVS is a nonprofit organization providing services, employment to any individuals or any professionals, newcomers, and we have been giving this offer for more than 75 years. So the program we are working in is the IEHP. It is for international skill apply for geriatrics. So it's a 12-week program. It's online and partnership with George Brown College. And with the George Brown College, we have 2 academic components, 2 courses delivered by the George Brown. I would say Essential of Counseling and Fundamental of Gerontology will get. And alongside our courses, the participants, the students will be having a one-on-one job search and career coaching, and we'll have mentorship. And also they will get some certificates, dementia care and gently persuasive approach, CPR certificate from Islamic Society, and food handling certificates and active aging certificates from Camp Fit Pro. And they will have placement, about 70 to 420 hours placement. And in the meantime, we will have the networking. We'll connect them to the healthcare professionals. And in the way, in the meantime, so if there is any opportunities with our employers, so they will have the chance to connect with the employers as well. So the eligibility is they must have the CLB 7 above, refugee claimants or conventional refugee with open work permit, and citizens, Canadian citizens less than 10 years in Canada, and refugee claimants. So if you're interested, so we'll have, you can reach to our website, or you can send an email to ISET@jvstoronto.org, or if you can visit our table, we'll be more than happy to help. Thank you very much.
Okay, thank you. I have one question.
Yes, please.
I will live in New Brunswick, in Moncton or Dieppe, maybe. So as it is, I would like to know if ISET is the training will be online, and do you have any branch in Moncton or New Brunswick?
If I get your question correctly, you're asking if this is the classes for French people? No,
it's not. Okay. Do you speak French?
No, I don't speak French, but this is an online course, and it's only in English.
Okay, but
only in GTA, yes, Ontario.
Okay, but will I be connected with employers?
So in case we have some employers as well. So in case if there is an opportunity, we will connect our participants to our employers as well.
Okay, thank you. I take the name of the I took the name of the association and I will visit.
Okay, thank you very much. Yeah.
Thank you.
Hello, everyone. My name is Roshni, and I'm an employment specialist and mentoring coach with Canada Infonet. Canada Infonet is a part of JVS Toronto, and we provide pre-arrival employment services to international graduates who are experienced professionals who are coming to Canada. And mentoring is a huge part of our service. And as everyone is aware, we have seen a huge rise in medical graduates, international medical professionals coming to Canada. And through mentoring, we provide them with licensing process. We help them understand the nuances of working here and in alternate occupations, etc. But the only gap here is that we need mentors to support them. So if you are an internationally educated medical professional who has experience in Canada and would like to give back to the community, please, we would like you to register as an online mentor. And we just ask for 1 hour of your time per week. So do visit our website or follow us on Instagram or follow us on LinkedIn, Canada Infonet, and we'll be happy to assist you. Thank you so much.
Thank you so much, Roshni, and thank you so much, Mohsen. I'm sure everybody will be finding this program very helpful. Thank you. And next we have Achēv.
Yes.
Hi, Dorothy. I'm good. How are you?
Everyone.
Hi. So we're going to pass the mic on to Dorothy now.
Perfect. Thank you so
Yeah.
much. Great.
Thank you. We'll have to use both the mic.
Both of them?
Yeah.
Okay. Hello out there. My name is Dorothy Gordon, and I'm working with an organization called Achēv, and it's spelled ACHEV. We have 2 programs that we're offering for our internationally educated healthcare professionals. One of them is called the HiCap program, which is the Healthcare Integration and Career Advancement Program. The acronym is HiCap. And what this program does is we partner with Toronto Metropolitan University to offer you a credential for people who are internationally trained professionals, whether you are in medicine or HR or project management. And this credential helps you to get into non-licensed administrative roles, such as patient care coordinator, clinical assistant, research assistant, and a myriad of other kinds of roles. And sometimes you can get in with positions if you have a specialty, let's say in ophthalmology or in cardiology, and work with professionals in that field in unlicensed roles. The program is 26 weeks in length. It's a $300 cost to join. However, if you take the courses and pass, you get the money back. And also, if you decide to take the whole suite of courses, it's $3,000, but that is completely covered once you pass your first 3 courses and get the reimbursement. We are currently taking applicants now for January for our healthcare project management course, which is currently dealing with people who are interested in getting within the analytics sphere of healthcare. In September, we'll be offering healthcare service management, which will help people who are interested in helping getting into the healthcare system in an administrative capacity. The eligibility for these programs is a CLB of 7. Either you can have a work permit, convention refugee, PR, or Canadian citizen. The other program that we have that we're featuring today is called the EPIC program. And that is what's the acronym there? The Employment Pathways in Canada Healthcare. And that program is designed to help people who were from internationally trained in pharmacy, lab technician, or as nurses. And we helped get your licensing and do a lot of support in that arena. What I do want to say is that these programs are really good because aside from the help that you get to get in, you're getting trained for free on how to learn about the Canadian labor market, the fine nuances, the soft skills that you need, interviewing skills, resume help, cover letter help. And we have fantastic guest speakers that are coming in that really help to give you that targeted advice and guidance you need to be very effective in the workforce. And I want to say that I know a lot of you are struggling being here, new to Canada, and we really need you here because we need the expertise in the healthcare. And you need to go in with the attitude that you have international healthcare experience and that you're going to bring a fresh perspective out there. And, you know, I know that you have a lot of barriers to get in here and a lot of barriers to getting your jobs. And you know what? Getting involved in any of these programs helps to mitigate that for you and also helps to build your professional network and build community with your colleagues and your classmates. So I would love to hear from you. Again, my name is Dorothy Gordon. I work at Achēv. And if any'd like to reach out to us, I'm sure there's a way to reach out to us through the program here. And I wish you all wonderful success and best of luck. Thank you.
Thank you so much, Dorothy. And
my pleasure.
I mean, it was a very optimistic presentation. Thank you so much. I think we all need this motivation. Thank you so much for that. Thank you. And now we move on to ACCES employment. We have Cheryl. Hi, how are you? Hi, so nice to meet you.
Very nice to meet you.
Hi, so we are going to hear from ACCES Employment about their services and IEHP specific programs. Thank you. And both the mics. This is for in person, this is for online.
All right. Thank you so much for joining us today. I'm Cameron Mosier, Associate Vice President of Services and Program Development at ACCES Employment. We offer a wide range of services for internationally educated healthcare professionals. We have a team of 10 with funding from the province, from the government, from the Canadian Pharmacists Association, and recently today, for the first time, we can announce funding from the Canadian Medical Association Foundation. So we offer a wide range of support centered on employment for primarily physicians and pharmacists, but for other allied healthcare professionals as well. Through our partnership with the Canadian Pharmacists Association, we are a proud delivery partner for the IPGMI project, which supports international pharmacy grads. We've also launched a nationwide project called Health English Language Pro in partnership with the CMAF. What that does is it creates opportunities for volunteer physicians, usually near retirement or recently retired licensed physicians, to create partnerships where they meet one-on-one with newcomer physicians to work on developing their English language communications that are specific to care environments in Canada.
Thank you so much. ACCES Employment is a very good sector partner for us, and we've been collaborating with all the organizations, and you've been with us for a very long time. Thank you very much. Thank you. And now we are going to SU.C.C.E.S.S. So hi, we'll hear from Kasik and Alan. Yeah.
Hi, good afternoon, everyone. My name is Tasik, and I have my wonderful program manager, Alan, with me. So we are from SU.C.C.E.S.S. We have our IEHP program, which supports international educated healthcare professionals to reintegrate into Canadian healthcare system. And we at SU.C.C.E.S.S. recognize that through our program that internationally educated health professionals being global talent and global experience that is, and also patient care at their forefront. And we also understand that they face significant barriers and challenges when they want to reestablish their internationally educated their health careers in Canada. And that's why we have this program, AHEP IEHP. Through this program, we support with internationally educated health professionals like doctors, nurses, pharmacists, psychologists, physiotherapists, all regulated healthcare professionals to integrate into Canadian healthcare system by individualized coaching, job training, at the same time licensing, navigation, and at the ultimate goal is to place them into paid workplace placement. And through our program, we also support through connecting with our partners and connecting to mentors, and also providing web subsidies for our employers in healthcare sector, which can last 50 to 70% for 12 to 16 weeks. And at the same time, we also have EDI and mental health and wellness supports for employers and also our clients. So in a nutshell, that's what we do. So we love to connect with you. And I would like to share a QR code in case you want to connect with us directly. So I think that would be a little easier for someone if I can show it on the camera.
We can also share it.
That would be great. That would be great. Thank you so much. Okay. All right. Thank you, everyone. If you have any question, I would love to know.
Excuse me, I have a
loaded in
question.
the computer already.
All right, great.
Oh, sorry.
Okay.
It's loaded already. All
I
the
would like to
information
know
on that
if
laptop,
you
which is connected to the screen.
help
It's
only
like,
the
okay,
newcomers
you know, here it is.
first. And the
It's
second
connected to
question
that
is
screen.
if you are acting in
Yeah,
Quebec.
that's my screen.
Okay,
That's-
I think let Alan answer that.
Okay, for sure. Hello, everyone. Very nice.
Hello.
No worries meeting all of you. Actually, I can add based on the eligibility for the program, you need to be either a PR or convention refugee or naturalized Canadian citizen. It doesn't mention how many years in Canada. We have some clients who have been like over 15 years even. So it's not the case that they need to be really new and fresh in the country. The other thing for Quebec, unfortunately, due to the different jurisdictions and requirements that are there, we are not the best person to help. However, if you reach out to us, we would be able to refer you to the appropriate community partner who helps Francophone or bilingual clients. Thank you.
Okay, thank you.
My
Thank you.
Thank you very much. Thank you so much. And now we'll move to Otemu and Inga. Hi, Deidre. So we have Deidre from IMGA here, and I would like to pass the mic on to you.
Thanks for doing this session and having us here today. So I'm Deidre Lake. I'm the executive director for AIMGA, which is the Alberta International Medical Graduate Association. We do serve internationally trained physicians across Canada. So we are renaming ourselves as ITPHub just to reduce the confusion. But basically, we offer supports for international trained physicians who are seeking licensure or jobs in healthcare or alternative career pathways in healthcare if they're not pursuing licensure. So the best way to describe our organization is we're very much interested in helping people make informed choices regarding their careers. So whether you are thinking of coming to Canada and applying for permanent residency, for example, we have information to help you navigate the pathways to licensure. We offer monthly sessions on all the different pathways across Canada on a monthly basis. We also have Ally, which is our career decision-making tool, and this is a questionnaire. There's the QR code and it's also available on our website. But we developed Ally to help people navigate the pathways to licensure. And because each province has different requirements, different pathways, licensure opportunities. And so ALA is the career decision-making tool that can help you keep up to date on any of the changes. We are consistently updating that tool. But if you fill that tool, when you fill that questionnaire out, then it will tell you, what steps you may have. For example, if you've done the qualifying exam part 1, or what steps you may be missing in order to be eligible for a particular pathway. This tool has been funded by ES.CC, so the federal government. And so it's our way of helping to make sure that people are making informed choices, that they are familiar with the different pathways across Canada and up to date on any of the changes. And so, like I said, we're continuously making updates to that tool, and because we want people to be able to make informed choices. So that's number 1. We have a career advising team that you can meet with one-on-one to help develop a career plan, a step-by-step guide of the steps that you need to do to become licensed. And then what we do is, based on where you are in that process and the pathways that you're interested in following, we will develop a career plan, not only the steps that you need to take, but the supports that are available across Canada. And that could be supports within AIMGA or supports with our partnering organizations and those that we collaborate with, as there are many supports across Canada. So we want to make sure that you get the right supports at the right time based on where you are in that licensure process. So we have QE1 study groups, for example, that's generally the first step for people who are preparing for licensure. Our QE1 classes are offered morning, afternoon, and evening, 7 days a week. We have
I don't use my slides. I'm going to be very quick because no one is here. So I just say if you want
and all of those journals are 12 weeks before the ACCES exam.
Introduce my program. I don't
Okay, we also have, sorry,
That's why I just solved it so that you can.
communication
don't worry
assessment
about it.
program. So for people who are new, wanting to understand the underlying values of the healthcare system, how to integrate successfully, either that could be, doing better on the natural state, for example, or, if they're in a practice readiness assessment route. So that is a course that we offer as well, and that's offered quarterly. We have our career readiness for health program, and so this is a self-led, online modular-based program. It's based on our previous career transition program, and so that also helps people who are trying to find employment understand sort of what is needed to navigate the employment world if you're new to Canada. So basically, what I would like to say, we have lots of networking opportunities, clinical workshops, and so on for internationally trained physicians. And we use our members, we offer mentorship through small group discussion or large group discussion. So people who have done the steps for you to share their lived experiences and their tips and advice and preparation. So really, AIMGA is a one-stop shop for navigating pathways to licensure and getting the supports that you need to meet with success. And of course, like I said, we work in collaboration with other IMG and ITP service providers across Canada to make sure that you do get the supports that you need. And so we look forward to welcoming you to our organization if you are not a member at this time. And again, I want to thank Pegasus, one of our partners that we have worked with in the past, to making this day possible and to giving us the opportunity to highlight the supports and services that we offer. Thank you so much. And I hope that kind of gives you an overview that we're kind of a one-stop shop for licensure and employment pathways into healthcare. Thank you.
Thank you so much for joining us today, Deidre. We really appreciate it. And all the services. And I have been one of the people who have been utilizing even the ALICE tools. So everything has been very helpful.
Excuse me.
There's a question for you.
Excuse me, it was not easy for me to hear what you said. So I have okay. But I have 2 questions. First of all, do you have any branch or any partner in Quebec? This is my first question. And my second one, that it's to know if your services are free.
So because we're an association, we typically do have a $50 annual membership fee, but that fee can be waived if you're a permanent resident or a Canadian citizen of Canada. So you just have to reach out to us and we'll waive that fee. It's not a necessity to access the programs and services. So that's important to know and a good question. In terms of Quebec, so we have a number of members who are residing in Quebec. And like I said, that's where sometimes we will reach out to those individuals who have pursued, different pathways in Quebec. We've had people matched to residency and, are working in Quebec. So we would, use our partners in Quebec to help you connect with them. We do offer our information sessions in French, and you do have the option to connect with one of our advisors and request a translator, and we will have a translator available at the appointment if you prefer to communicate in French. So that's what I can say about Quebec supports.
Okay, thank you. Can you say again the information about the fee?
So the fee can be waived. You just have to use our online drop-in and speak to one of our advisors or reach out to us at info@AIMGA, so info@AIMGA.ca, and we can waive that fee for you if you're a permanent resident of Canada, for example.
Okay, thank you.
You're welcome.
Thank you so much, David. Thank you. And next we have Ellen and Div from Toronto Metropolitan University. So I'll pass the mic on to you.
So my name's Ellen. I'm here from Toronto Metropolitan University. And I'm here representing the International Midwifery Pre-Registration Bridging Program, which is a bridging program for midwives. And I think that what would make the most sense, unless anybody has any specific questions, is there'll be a link to our program with more details about the program admission criteria and application process that will be sent. Is that right, Mohammed? It'll be sent. My information for the program will be sent to everyone afterwards and available online. It's available on the Pegasus website. So if you have any specific questions, there'll be an email link there. Or you can email us at impbp@torontomu.ca. But our program is online. It's a 6 to 9 month program that includes a 12-week clerkship. And we also are pan-Canadian. So midwives can apply and attend our program from all across every province in Canada. And yeah, that's it. Thank you. I think it'll just be easier to send people to the program link and then they can ask questions. Thank you for that hand clapping. Unless anybody has any questions online.
Thank you. Thank you. And next we can hear from Oneness.
Yeah. So hi everyone. So my name is Oseswa, but you can call me Amos. I'm also an internationally educated healthcare professional. Okay. I'm also an internationally educated healthcare professional, so I'm an IMG. But I do a lot of work in medical education, so emergency response training. So for a lot of IMGs, I noticed, and of course, nurses as well, IENs, and even pharmacists, I noticed that a lot of them required training, emergency response training. So things like basic CPR, standard first aid, basic life support, and then even the advanced cardiac life support, and then of course PALS, as pediatric advanced life support. So I'm giving those trainings every year. We're doing it in cohorts within the GTA, Hamilton, but for the advanced life support trainings and PALS trainings, we do them in Mississauga. So you must be an IEHP to get the discounts that we're giving, the subsidized trainings that we're doing. We've tested it out between August and October. and we've done 2 cohorts, or we've been able to test that out with like 30 internationally educated healthcare professionals. I think 12 IMGs who are going currently, who are applying for CAMS and PRO and PRA as well, because by the time you want to apply for those jobs or apply for your licensure through the college, you would need those trainings. The other thing is we ensure that we got also instructors in our team that have, for example, I am a BLS instructor with heart and stroke as well. So CPSO recommends heart and stroke. For College of Family Physicians, Canada also recommends heart and stroke. CPSA Alberta, heart and stroke. CPSN Manitoba, heart and stroke. So heart and stroke, which is the equivalent for AHA, that's American Heart Association. So we are trying to make sure that it's subsidized. And I'm doing it because I am also an IMG myself, and I see the value in it. So at least you're going to get anywhere between 25 to 30% discounts as far as you're an IMG, you can identify, or an IEHP, as the case may be. So it's really a fantastic program. I myself, and then even other conversations in those calls usually would happen as well. So on the slide, see, this is some of the showing that over 2,000 learners for first CPR over the past 2 years, and then specifically, yes, and specifically our IEHP programs. IMGs, we had 12, pharmacists, we had 3, INs, we had 2, and then other allied healthcare professionals, we had 12. These are some of the feedbacks we're getting from the people we have trained. You can see me in the picture there, and these are some of the testimonials we have from the community. Just to let you guys know that, yeah, this is running and it's happening. Like I said, we have heart and stroke BLS instructors, we have ACLS and PALS instructors, we also have CRC, that's Canadian Red Cross, first aid and BLS instructors as well. That is in the picture. I'm partnering with several training partners to make these trainings happen. So just let us know. So if you're interested, this is a QR code for a WhatsApp group where we'll be updating you on any upcoming cohort. So you can just join the WhatsApp group by scanning the QR code, sign up, and yeah, I'm happy to connect with you guys later today in the evening. So just sign up if you're an IMG, if you're an IEHP, if you are a nurse, you're a pharmacist, you're any other healthcare professional, mental health, anything. So from as far as international, I want to make sure you're able to get affordable emergency response training. Thank you.
Thank you so much, Azizwa, and thank you so much for explaining the training program. And thank you all so much for the audience here for participating, and you also giving your feedback and listening to us. We will be sharing all this information online. These recordings will be available on the website. And if you have any questions, you can also reach out to us through our website portal or through the email, and we'll be happy to answer your questions. So once again, all the very best for everybody participating and everybody attending here. I know you're all in different stages of the journey, and I'm one myself. So let us all move together, and I wish you all the best. And I hope to see you all soon. Thank you. Thank you very much.
Good afternoon, everyone. So at this time, we are at the end of our delivery for today. And I would like to say thanks to all the participants that joined the session, to all our exhibitors or facilitators. So to Dr. Felipe Santos for facilitating our IMG breakout session, to Dr. Nasrin Alassaz for facilitating our International Educated Nurse breakout session, to Huda Sorelli Gilbert, Shango, Noura Bension d'avoir animé nos conversations francophones, to Dr. Wassem Al-Sabah I would like to say thanks as well for facilitating our international pharmacy graduate session. And to Toronto Metropolitan, the Chang School of Continuing Studies, Planning, Career, Progress in the Progress Career Planning Institute, AIMGA coming all the way from Alberta, Evergreen College, Access Employment, S.U.C.C.E.S.S, Oneness Education Foundation, Achēv, JVS Toronto, and to our Pegasus staff that come together to make this event possible, I would like to say thank you. To our project coordinator, Saida Azam, would like to say thank you for the work that you have been doing. To Mohammed Nashat of Betac IT Limited, would like to say thank you for the tech support for our events. And that is it. As we disembark from this event for today, I would like to just leave you with one thing. As an internationally educated healthcare professional in Canada, just understand that you belong in the healthcare system. You don't necessarily need to be licensed to start your practice, so start today, okay? Do not try to navigate all the possibilities. Just look at one specific area and focus on that specific area. Once you are able to focus, you should be able to gain grounds, and I guarantee you, you will be successful in terms of navigating the system itself. Don't forget the brokers, and if there's nothing that you leave with here, leave this place with today, just make sure that you are all reaching out to those brokers, so the community-based organizations, to support you, to connect you, whether it be volunteering opportunities, employment opportunities, whatever those are, they become essential in terms of your experience and getting you to where you need to get to. Thank you, everyone, and enjoy the rest of your afternoon.